So if you have any of these symptoms, you must urgently consult one nearby doctor. So what does the doctor do is he will first take your history, and history means what are your symptoms? Are you feeling any breathlessness, any chest pain, and any lightheadedness? And he will do physical exam to see what is your saturation level in your blood, and what is the heart rate, what is the blood pressure, and he will examine your lower limbs. Is there any swelling, tenderness? So if there are all the features present, then you have a high likelihood that you have pulmonary thromboembolism. So now, to confirm whether you have pulmonary thromboembolism or not, he will order some tests. So to look at the pulmonary arteries, we have one beautiful study called CT pulmonary angiography. So in that study, we will inject one contrast or dye into your peripheral veins, means the veins located in your hands or legs. From there, this contrast will go into your heart, and it will go into your lung arteries. So after injecting this dye, we will do the CT. So this dye increases the contrast of your pulmonary arteries. So if there is any block within this pulmonary arteries, we can clearly see whether there is any block or not. So this is nowadays the standard of diagnosing the pulmonary thromboembolism. If you have any contraindication for this study, like you have allergy to the contrast, then we may give for other nuclear medicine based study called ventilation perfusion scan, in which a radioactive dye is inhaled and also a radioactive dye is injected into your peripheral veins. So that dye can be examined in a special scanner. So that will tell us what is the level of circulation in your lungs. Is there any defect in some part of circulation, and is there any defect in the ventilation of some part of lung? So that is also one more examination to diagnose the pulmonary thromboembolism. So next thing is to know the cause, where it is coming from, the clot, where it is coming from. We may order the color Doppler study of lower limb veins. So by this study, we can see is there any clot in your lower leg veins, or sometimes you can develop clot in your upper limb veins also. Like in chronic intravenous drug abusers, they will inject drugs repeatedly into their upper limb veins. Those can get blocked, and that clot can migrate to the lungs. So that also we can diagnose. And moreover, in these IV drug abusers, these clots are most of the times infected clots. So that infected clot will go to lung, and it will cause infection in the lung also. That condition is called septic pulmonary embolism. So all these clots in your limbs can be diagnosed with your ultrasound color Doppler. Other test, blood test is a D-dimer test. It can recognize if there is any clot anywhere in your body venous system. So that is knowing the cause. And to know the risk factor, we may do certain tests. If you have an obvious risk factor like prolonged immobilization or long distance travel, then there is no need to test for the cause. If you don't have a specific obvious reason, then we may need to do additional tests to diagnose the cause of this blood clotting in your veins. So this may include genetic tests to detect any genetic abnormality that predisposes to blood clot formation in your veins, or certain scans or tumor marker tests to detect any cancer, any dormant cancer, underlying cancer in your body. So, and any kidney disease which can predispose to these clots. So these are all the tests you may undergo while you are evaluated for the pulmonary thromboembolism.